When deciding which assistive device to use, you must take into consideration the support and stability provided, as well as the patient coordination required for the use of the device. Parallel bars provide the most support and stability while requiring the least amount of patient coordination. When choosing an assistive device, you should look at the amount of weight bearing, balance impairment, or amount of strength they have in their lower extremity. There are charts in your handout that should help with decision making based on these three characteristics. A standard cane can be used when you have a patient that is minimally balance impaired. Additionally, a cane can be used for unilateral lower extremity weakness. Lofter and crutches can be used for significant bilateral lower extremity weakness or bilateral lower extremity weight-bearing restrictions. A walker is used for significant lower extremity weakness, both unilateral or bilateral, as well as used for a moderate or significant balance impairment. Two crutches are used for less than 50% partial weight bearing, toe touch weight bearing, or non-weight bearing gait. They can also be used for balance impairments and significant lower extremity weakness. Initial gait training should occur in a distraction-free environment on level surfaces. Training requires focused concentration to learn the gait pattern properly. A patient may require visual input of foot and assistive devices with respect to the body position. Ensure safety by keeping the area clear from obstacles and distractions. Frequent rest periods may be necessary if a patient feels fatigued. Monitor vital signs and rate of perceived exertion. When instructing a patient on a new assistive device or gait pattern, demonstrate the proper use of this technique. Use verbal descriptions that should reinforce your demonstration. Be sure to use simple, patient-friendly language. A patient may be unstable during initial gait training. Ensure safety by using a gait belt and properly guarding through the initial gait training sessions. A status of non-weight bearing means that the involved lower extremity is not bearing weight. It is not allowed to touch the ground at all. You can tell the patient to bend at the knee or hip to keep the foot off the ground. Toe touch weight bearing is when the toes of the involved lower extremity are allowed to rest on the ground for balance. The involved lower extremity is not permitted to bear weight. To remind the patient not to weight bear through that toe, tell them that they are stepping on a potato chip that they do not want to crush and clean up later. Partial weight bearing allows a limited amount of weight bearing on the involved lower extremity. This gait pattern requires 3-point gait that will be discussed in Skill 30. Weight bearing as tolerated occurs when the patient has limited restrictions. The patient will determine how much weight will occur on the involved lower extremity. This can vary from minimal to full depending on the patient's tolerance. The assistive device is used just to take slight weight off of the involved extremity. In full weight bearing, a patient is allowed to bear full weight over the involved lower extremity. The assistive device should not be used to alleviate weight, but can be used as a balance assistive device.